Israeli forces have again targeted a UN-run school sheltering displaced Palestinians, killing 16 people and wounding at least 50 others. Now, this attack happened at the Nuseirat refugee camp in central Gaza. The number of victims is overwhelming Gaza's largest remaining health facility, the Al-Aqsa Hospital. Hamas has rejected Israel's claims that the army targeted fighters who were operating near the school. Well, let's go straight to Hani Mahmoud, our correspondent, who joins us now from outside the Al-Aqsa Hospital in Deir al-Balah in central Gaza. Hani, as we were saying earlier, the death toll from that attack has been rising. You're outside the hospital where so many were taken. How is the facility holding up?
Well, right now, just given the past 9 months of too much pressure on this remaining health facility in the central area, the situations inside are quite dire, not only from the influx of injuries, but also from the large number of evacuees and displaced families who are literally filling up the corridors of the hospital, just making the job of the medical staff and volunteers here, medical missions, and largely people who are here to support and help quite difficult, because these people, the displaced families across the Gaza Strip, are kept pouring into the central area more recently from Rafah city and Khan Yunis. And just within the past half an hour, we get confirmed reports of more people, more displaced families are crossing Wadi Gaza all the way to the central area. This is definitely going to put more pressure on this health facility. But other than this, the tragedy is the large number of casualties brought to the hospital here is the kind of injuries that they are experiencing, and the difficulties that the medical staff is always having here to intervene properly, to provide a proper medical intervention to save life here. For the most part here, doctors, just given how exhausted they are, the acute shortage of medical supplies, they just make their job extra hard, just to get a better picture and better context of what's going on inside the hospital, of some of the cases that are experiencing severe trauma, particularly among vulnerable group here at the hospital. We are joined by Dr. Yousaf. Dr. Yousaf is an internal medicine and paediatrician from Mid Global, to tell us more about what's going on inside with these cases. Dr. Ahmed, thank you so much for joining us. And let me start off by asking, just give us a picture, an assessment of what are the situations inside the hospital.
So currently, the healthcare system is completely overwhelmed because of what appears to be a complete targeting of all the healthcare infrastructure in this small strip of land with 2.5 million people in it. The few hospitals left functioning are in a state of chaos. Right, every few hours we are bombarded with ambulances bringing in people in pieces, and women with their abdomens eviscerated, little children with shrapnel injuries, men dead on arrival. We have an environment where, along with this, the chaos of emotional families who have just pulled their families from the rubble, coming in emotionally distraught, traumatized emotionally and psychologically what they just experienced. And then beyond this, you have medical staff who are part of this community who the first question they ask is, where was the bombing? Is this my family member? Which neighborhood is the first question you hear. And often, because of how small the community feels, they're treating their family. This is everybody here is family, and so beyond the physical impact and the physical trauma, we're seeing a component of emotional distress that I couldn't have imagined.
Dr. Ahmed, let's talk more specific about cases that you have been dealing with since your arrival to the hospital to volunteer inside all the remaining health facilities. Like, walk us through some of the cases that are experiencing traumatizing conditions, particularly among children and women.
This is especially poignant and hard to speak about, given what happened yesterday. There was a bombing of one of the schools, and we had child after child after child get brought into the resuscitation room with different extents of traumatic injury. Standing over one child intubated with a depressed skull fracture, another with a shrapnel injury, probably 10 years old, so severe that we could see an exposed kidney and likely a transected spinal cord, trying to rush them to the OR to salvage what we could. And then in the backdrop, as a pediatrician, I see small children sitting in the corner with lesser physical traumatic injuries, but no doubt witnessing death and destruction and dying in a way that their little brains could never be capable of coping with. And so we spoke about this briefly, but the psychological impact beyond the physical impact will be generational. And so if I go into the psychiatric understanding of epigenetics, when we talk about exposing small children with plastic brains, meaning the ability to morph and change to this level of stress, physiologic stress from adrenaline and stress hormone. You know, we sit here and we hear the hums above us of drones, which can often mean another attack is coming, and the children, they are completely aware of this, and they look up in fear and they're startled by any loud noise. The effect on the unraveling of DNA and the epigenetic research shows us and tells us that this is often permanently opened, and that the impact can even be carried generationally in their children. The trauma doesn't just happen in the 3 or 4 year olds now, it happens in their children and their children after them. And so this would take decades of therapy and cognitive behavioral therapy to try to unravel and unwrap, and the worst part is we're still in it. So there's no opportunity to deal with psychological and psychiatric trauma when we're still dealing with the physical trauma, the lack of surviving today, finding clean water, finding enough medication to survive today. So thinking about the long-term effects seems silly, except that you watch these kids' eyes, and that's all I can think about is even the ones who survive will experience trauma forever.
Dr. Ahmed, I know this is your first time visiting Gaza and being in one of its health facilities, but I know this is not your first time being part of medical missions worldwide. Can you draw on your personal experience? What's the difference if we set for compare and contrast matter here? What is the difference here?
Yeah, I've had the opportunity to work with Med Global and other organizations and treating other refugee groups in medical missions around the world, and I will say there is nothing like this. I've been in fields in Greece taking care of Syrian refugees and the Rohingyan refugees in Bangladesh, where it was those were extremely difficult situations. The difference between those things and this is that this is a killing box. There's no way to escape, and the ongoing trauma daily, every hour, is unimaginable. We sat as physicians and family members and people back home in the States where I'm from, and we watched things on TV and saw some news clips from news agencies like yours or social media, and we cried and we were worried, and that's what was the impetus for me to come. And when I landed here, from the moment I landed and I saw the level of devastation, I could have never ever have imagined it based on what I had seen. The videos and these interviews never do it justice. The blood on my hands and the eyes I have closed for the final time of patients on the floor because they don't have stretchers and medication, the screams of horror from mothers who've lost their children, it will, you know, it'll be with me forever.
What's urgently needed inside the hospital now? I know it's too much going on inside the hospital with the lack of medical supplies, exhaustion of medical staff as well, but to save lives, what's needed right now?
The bleeding has to stop. The bombs have to stop. And access to all types of humanitarian have to be allowed. You know, if there's any doubt from anybody whether or not humanitarian aid has been allowed, I can promise you the answer is no. I was restricted. I had multiple suitcases of many wonderful people in America who knew that something was going on and tried to donate and help with medical supplies, and I wasn't allowed to bring anything except a suitcase. The hospital is empty of the supplies needed to take care of the death and dying. If I could say one last thing that I think is important to understand in terms of the greater scope of what's happening. When we heard the numbers of how many had died, 16,000 children and 45,000 other people, civilians being killed in this, the number is underestimated. And the reason I say this is, as a medical professional, this ICU where I work today is full of DKA patients, diabetic patients, who get a very treatable disease, but they're dying of the most simple thing because the insulin is unavailable, because they're not allowed to bring it in, and refrigeration is gone. There are people dying of chronic, as many amputees as they are from the trauma. There's amputees of diabetes uncontrolled. And these people will be permanently disabled after this war. The numbers are vastly high. I would say 4, 5, 6 times higher easily, let alone the ones who will die in the decades coming from both the psychiatric trauma and the physical disabilities associated with what's happened in the last 9 months. What they need in the hospital is the bombing to stop and some level of stability and flow of humanitarian aid and medical supplies.
Dr. Ahmed, thank you so much for your insight. Thank you. So as we heard from Dr. Ahmed, the horrific description of of what's going on inside the hospital here with some of the cases that are quite treatable, but people are dying here at the record number because the lack of medical supplies and the inability to intervene and to save life. This is the only remaining health facility here, but soon enough it's going to be pushed out of service, just given how difficult the situation's inside of it.
Hani, Mahmoud, they're showing us what life is like on the ground right now in central Gaza. Thank you, Hani.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.